Dini second lecture or pediatric topic headache in children ma. Major na me gun shi solution chabas ma put haruya ba. Maru pidwa lu shin pian bio ki bi ba me no.
Minglava. Dini headache presentation go la jare taru tamiro alongo Jesu demare. So aku maro aku tamanji da bono aku loloze aku tadedua go ya lao shire so hopefully that should be enough. So this is a small group teaching bono so I trying to be very interactive as possible. Maholo shin တင်းစရာကောင်းတယ်လေဟုတ်တယ်မလားသားတို့သမီးတို့လည်းတစ်ချိန်လုံးဒါပဲ listen လုပ်နေရတယ်ဆိုလို့ရှိရင်ဘာပဲဖြစ်ဖြစ်လူတယောက်ရဲ့ concentration not more than 50 minutes အဲ့တော့အဲ့လိုပဲဒါကြီးပဲပြောနေလို့ရှိရင် mind ကတော့ drift ဖြစ်သွားမှာပဲเนาะဆိုတော့ဒီကြားထဲမှာမလည်း question တွေမေးမယ်အဲ့ဒါကို chat box ထဲမှာထည့်ပေးပါတတ်နိုင်သလားပေါ့เนาะဆိုတော့ဒီနေ့သင်မှာတော့ headache in the children ပေါ့เนาะဆိုတော့ကဲဒီဟာသမီးတို့လည်းသားတို့သမီးတို့အားလုံးနဲ့ဒီအားတွေကိုအများကြီးတက်လာပြီးပြီဆိုတော့ကဲ topic ကိုလည်းသိတယ်ဆိုတော့ what do you want to learn today what do you want to achieve what's your expectation chat box ထဲမှာထည့်ပေးပါ if you can emergency condition ဟုတ်ပြီဆိုတော့ emergency condition အထူးသဖြင့်ဆိုလို့ရှိရင်တော့ဥမာ life threatening situation တွေပေါ့နော် causes ဟုတ်ပြီ differential diagnosis of headache in children different type of headache lovely so ဟုတ်ပြီဟုတ်ပါတယ်အဲ့ဒီတော့ဒီမဒီနေ့ပေါ့နော်ဒါ learning objective ကဘာလဲဆိုတော့ let's see how can I move So learning objective. So how to assess? How to assessment of the common causes of sort of assessment of all the headache in the children. So now what are the common causes? And then emergency condition. That's one to worry and one to make a referral to the specialist. In a way, is to the pediatric specialist. Most of the time, I'm hoping it's going to be a pediatrician, but there might be a time you might have to refer to another specialist as well. And then what are the investigation? And then how are you going to manage? Possibly, by this presentation, we are aiming to the final part to medical students, of course, and also to others like junior doctors, like newly qualified doctors, and also hopefully for the general clinician, no, particularly in the general practice. So how to manage those sort of chronic conditions, which are not life-threatening. Emergency resolution, no, you have to refer to the emergency department. So these are the learning objectives. So headache. So headache, is that something people worry about? But so headache is like or abdominal pain, binary is all the pit to them. How them la? Who can't get this rally? Do I can't get that? How them la? Siamaru le can't get that. With all of the middle can't get that. Why do we have to worry about it? And why the people worry about it? What are they worried about it? What do they worry? Meningism, how about it? How did meningism? So mostly are meningitis, but no meningitis penina. Headache resolution, meningitis pin, but also meningitis. How did CNS infection? Because it is easily treatable. How if we caught it in time, we can treat it easily. And then, they can also present with the fever. Yes, interfere with the daily activities. If you got the headache all the time, you cannot do anything. Increase ICP. Yeah, so increase ICP. This is what the people worry most. How to the pin, me buy report, no? Gong kind of down in the to the pin down that type of so so increase intracranial pressure. What are them? Yes, brain injury. Yes, brain injury are the brain injury. Down the number to chapa worry increase intracranial pressure. တခါကမိဘတွေကပြောချင်မှပြောမယ်ဒါပေမဲ့အဲ့ဒါကညာတော့အဖြစ်အဲ့ဒါကိုစိတ်ပူကြတာလေစိတ်ပူကြတဲ့အတွက်ကြောင့်မို့လို့လာပြကြဟုတ်တယ်မလား head ခေါင်းကိုက်တဲ့ဆိုတာနဲ့ brain tumor yes brain tumor ကိုသူတို့ worry ဖြစ်ကြဒါပေမဲ့ how common is it headache နဲ့လာတယ် intelligence what do you mean by intelligence Joe yeah cerebral herniation in ပေါ့နော် cerebral herniation ဖြစ်နိုင်ပါတယ်ဒါပေမဲ့ cerebral herniation က headache အလုံးနဲ့တော့မလာဘူးပေါ့ဒါပေမဲ့တခြား symptom တွေလည်းရှိတယ်ဆိုရင်တော့ဟုတ်ပြီဒါကိုပို့ပြီးတော့စိတ်ပူရမှာပေါ့နော် so worry by the parents so မိဘတွေက worry ဖြစ်တယ် so ဆရာမထင်တာတော့ဒီ intelligence affect ဖြစ်မယ်ဘာကြောင့်ဖြစ်မလဲဆိုတော့ headache ကmaybe going on ဖြစ်နေတယ်ဆိုတော့ it can impact on their daily activity and school attendance so that will indirectly affect your learning နော်ဟုတ်ပြီလား so အဲ့ဒါကြောင့်အဲ့တော့ဒါပေမဲ့ how common so the headache is very common but most of the times what is the common cause is that the common cause is brain tumor what do you think or the infection yes infection could be the most common cause what else could that be so let's have a look so headache is a common presentation ဘာကြောင့်လဲဆိုတော့ everybody has a headache ဟုတ်တယ်ဒါပေမဲ့ most of the time မှာဆိုလို့ရှိရင် headache က most of the time are usually caused by the common things like maybe viral infection or sometimes yes there could be emergency thing like bacterial infection but most of the thing is the viral infection the main thing is we need to look for the treatable causes headache caused by the brain tumor is very very rare and then they rarely come with the isolated symptom of headache. This is our task to rule out those serious and life-threatening conditions. That's why they come in. That's where we need to have the proper assessment. And prevalence. So it is very common. So prevalence can increase with the increase in age. And at 12 years old, the ratio, male to female ratio is more or less the same. After 12 years of age, they are higher in female. It's between male to female is round about 1 to 3. And then many children experience the headache. So 20% of the children aged between 4 to 18 have the frequent or severe headache in the past 12 months. It is very, very common. So to assess the headache, you need to know the classification. So we got primary and secondary. So what is the primary headache? What do you think? Right. So Dima and Mama now what the coup Dima and question why is higher in female after 12 years? What do you think? Why is it higher in female? Essential HA. What does HA mean? Essential hypertension. Well, what do you think? I think it is more higher in females. That's my guessing. You can go and do the research, or that might be your research project. And but because they are the hormonal changes, and also hormonal changes with the puberty entering. What happens during that menstruation period? When do we have the periods? What happens? Yes, worries and anxiety more common in female. Yeah, it could be. It is, isn't it? And with those hormonal changes, what happens during that period? You could be moody. You could be extremely vulnerable. You can get highly anxious, and that can cause you more headache. And then many of you may, well, I don't want to bring up for another sort of discussion at the moment, but you might also heard about menstrual migraine and things like that, that we can talk a bit more in the migraine, or, you know, there are the sort of areas you can read a bit more. I will put that in the resources later. Okay, so the primary headache. So the primary headache are very common. No, this is a more common than the secondary. And the primary it not caused by the underlying disease or condition. It is a dysfunction or overactivity of the pain-sensitive parts of the body in and around the head and neck. Mostly combination of the nerve, blood vessels, and muscles. And then this is what they thought may play a role in the primary headache. Okay. Do you know any of the primary headache? I've already mentioned briefly during the discussion. Do you know any kind of primary headache? What could that be? Migraine, yes. So migraine is one, tension type headache is another one. Yes, these two are the most common headache in the children. And also, I bet, in the adults as well. Yes, trigeminal neuralgia is another one, although it is very rare in children, thankfully. Right, okay, so these are the primary headache. So this is from the up-to-date, the characteristic of the common headache syndrome in children and adolescents. So you all are absolutely right. So we got migraine, tension type headache, and the trigeminal autonomous cephalalgia. Usually we say it's a cluster headache because it is more common, well, sort of common one in this group. And then we see them, well, often in the children. So as you can see, there are some differences between these three common type headache. So the location, migraine, the migraine, it can be both bilateral or unilateral. So bilateral, unilateral in 60 to 70%, but bifrontal or global in 30%. But again, it could be bilateral, especially in the younger children. But the tension type headache is most commonly is bilateral, and it is usually diffuse. Trigeminal is always unilateral. So that's the distinction between them, I like to think. And I have to emphasize that it is still very rare. It is usually unilateral, and it usually begins around the eye or the temple region. So the characteristic, so the migraine. So migraine is more gradual onset, yeah? And then it's usually, it is a pulsating in character. And then they are between moderate to severe and intensity, and it is aggravated by the routine physical activity. That's how migraine are debilitating. Migraine, it interrupts your daily activities, which is different in the tension type, which is usually wax and wane, and it's like a pressure headache or tightness in their head. And then usually with a tension type headache, you can carry on your daily activities. But with the cluster headache, it is an acute onset, and then it's usually reached to the peak within minutes. And the pain, everybody say that it's very excruciating pain. And it's very, very rare. I never seen one in my, 20 years of pediatrics, but you never know. But maybe if you are a neurology specialist, you might see a bit more, and then you might tend to diagnose more because you got more experience. But usually it is so with the cluster headache, it is unilateral, it is excruciating pain. So the next one is a patient appearance. So usually with the migraine, you prefer to be sitting in there or sleeping in the dark room, and then you don't like any noises, usually. But with the tension type, like I said before, they can carry on with their daily activities. With this cluster headache is also, they can do whatever they are doing. So the duration. So duration, migraine are maybe only a few hours. It can also last up to 3 days. Tension type is variable. It like, you know, it's already mentioned that it's wax and wane. So it may come back and then you might be a bit more down, and then you can carry on doing so. It can be distractible. This is what I mean to say. The trigeminal, well, the cluster headache are not more than 3 hours, usually up to 3 hours, and then they go away. So what are the associated symptoms? So with the migraine, you already know, or most of you probably know, like they come with a nausea, vomiting, photophobia, phonophobia, and that they may have the aura. It could be visual, there may other senses really involved in that. Tension type headache, no aura machine. Cluster headache ajaro bayune la naine solution to ipsilateral, no? So one-sided symptom usually are the nasal symptom redness of the eyes So these are the brief description of the common headaches that will just for the information. Why does the trigeminal neuralgia goes away after 3 hours? What do you think? It all depends on because of the basic, you know, basic pathology. That's the main thing. Yeah. And it is fairly, very rare in the children. So I don't know the background pathology, but that's something you can have a look, Serena, but maybe you can research after this. And then this is what you learn. This is what I want everyone to do. Yes, you know the common things, and then you just have to go and find out like, okay, this is why is it? Make it that curious. And then look out for that, like, okay, how can I search that? That will make you stimulate. So the presentation teaching to stimulate your brain, and then to stimulate you to learn further and make you more interested in medicine. Okay? Right, so go to the next one. So secondary headache. Oh, I already gave it away, isn't it? So secondary headache can be anything, because it caused by the secondary to the underlying disease or condition. And then that triggers the pain-sensitive areas in the head. Fortunately, they are very rare, but it is important to detect them because they could be more worrying and can lead to serious complication. And most of them are thankfully treatable, yeah, if we caught it in time. So that's why it is very important. So secondary headache, what are they? So infection, it could be either viral causes bacteria causes it could be around the all area in the head and neck. So some of you already mentioned about meningitis, meningoencephalitis, and also there are some sort of localized things like sinusitis, dental caries, dental abscess, temporomandibular joint problems, or ear infection, or the eyes infection and optic neuritis. These can all cause the headache. And then trauma, so head trauma, injury to the head and neck, that could be either RTA, like road traffic accident, or, and in younger one, like babies, you need to think about their neck accident injury as well. Intracranial disorder, this is the one, the most important, and we don't want to miss. And it could be vascular, non-vascular. So vascular is intracerebral hemorrhage, central venous thrombosis, and then subarachnoid hemorrhage. Again, thankfully, it is very, very rare in children. The subarachnoid hemorrhages, you might see more in the adults. Non-vascular, that's where your brain tumor come in. And the other one is also fairly common, is an idiopathic intracranial hypertension, which used to be called benign intracranial hypertension or pseudotumor cerebri. And the secondary headache can be due to a medication or substances. The common medication is like medication overuse headache, like simple analgesia, like, you know, if you're taking painkillers like paracetamol and ibuprofen every day, mostly every day for a good 2 weeks, and that can still cause you the rebound headache. Other things like, I think many of you know, like alcohol, cocaine, and carbon monoxide poisoning, they can also cause this as well. Systemic hypertension, again, you know, that is very rare, but it can happen, especially if you got the underlying other disease, and then that can present with hypertension, but it's more common in adults. Yeah, so Holly asked how neonate can present with headache. They can't, because they can they tell you? They can, but they present it with the other things. What I mean is a secondary heartache, especially when they got the meningitis and things, although the neonate, they cannot present, whether they cannot tell you that they got the headache, but how do they show it? Does anyone know? How do they show in the neonate? Obviously, they cannot present with headache because they cannot tell you, I got a headache. Even, you know, they might not know that. Barging fontanelle, yes, because they show maybe signs of raised intracranial pressure. Absolutely. Anything else? Crying, yes, they could be extremely irritable. Absolutely, yeah. And also irritated, yeah. And also I mentioned about this, you know, about non-accidental injury, isn't it? So what could you find in your assessment? You might see sort of any bruising or unusual features. And also, you know, the child may not be well kept. That's mean like not well looked after. They might can be not malnourished ပေါ့နော်အဲ့ဒါမျိုးဝတ်စားတွေကလည်းစုပ်ပြတ်နေမယ်အဲ့ဒါမျိုးတွေလည်းဖြစ်နိုင်တာပေါ့နော် That's you need to be mindful as well, especially in the younger one, because they cannot tell you I have a headache. Yeah, because they cannot tell you, do they? Okay, right. So these are the secondary causes of headache. So what are we going to do next? So assessment. So how are we going to assessment? So we are going to do history and examination. And it is a very important and cornerstone of any medical assessment of any symptoms. I cannot stress enough. That will give you the possible differential diagnosis. So thorough history and relevant and focused examination is very important for any symptoms. So this is a headache history. So what are the things do you want to explore in headache history? So I'll go to the flow. What do you think? What are you going to ask? Duration, yeah, good. Pain, that's right. So yes, I already gave you the clue. So yes, with the headache, so head pain. So you got onset, you got the characteristic of the pain. Yeah, duration. Anything else? Yeah, so precipitating factor, exacerbating factor, associated symptom. Yeah, associated symptoms. Anything else? Aura, yes, so aura, so associated symptom. Any other particular sort of like aura, particularly if you're looking for the migraine, yeah, of course. Asset on the daily activities, yes, right. Some more, please. So you asked about the onset, duration, yes. You know, where is the pain, whether it's a unilateral or bilateral? Yes, severity, of course. Yes, severity. How severe is that? And then quality of the life assessment. Okay, yeah, that's good. Quality of the life assessment is good. And then partly I would say, yes, so what are the precipitating factor? So you asked for the precipitating factor. What else could that be? Relieving factor, isn't it? You need to know the relieving factor, which is relieving factor can be the other things like that will give you the clue. Yeah, features of raised intracranial pressure. Yes, that's really important, isn't it? What are those? What are those features of increased intracranial pressure? Projectile vomiting, yes. Projectile vomiting, and then usually, particularly when they wake up from the sleep and then they wake up in the morning with the early morning vomiting. This is what we wanted to know. Yes, a hypertension will come in the examination, so keep the thought. Anything else? Blur vision, yes, so they can come with the visual abnormality. Now it could be blur vision, visual disturbances, or sometimes they have that new onset, nystagmus and nystagmus or squint, new onset squint, yes, bradycardia, again, this will come in examination. Yes, fever, this is very important because the fever will come, and then it is important to know, isn't it? If that's the case, and fever, most likely we don't want to miss the meningitis. Yeah. So raised intracranial pressure, you already mentioned about visual disturbances. Yeah. And also the other thing in the symptoms, these are the symptoms, features. So what else could that be? Like they have the new onset seizures, like you never know. So new onset seizures, subtle behavior changes, or people become very aggressive or a bit confused. So that's not right, no? And also there might be school difficulty, particularly like bright child clear, bright that might be not very obvious, but maybe the subtle changes, but you need to take it into the account of other symptoms as well. Now, other thing is the coordination difficulty, like abnormal coordination and steadiness, no? Or very clumsy, very clumsy, another sign, especially associated with headache, that you need to think about whether these are the neurological symptoms. So we need to worry about brain tumor, that kind of thing. So, and if we go back to the head pain, no, now quality, no, quality is blue pain mule, blue pain mule, throbbing, pulsating, no, and tightness, excruciating pain. Duration will give you what could that be, and also like frequency. How often does it happen? No, how often does it happen? Is it every day or once or twice every month? That kind of thing, because that will impact on how you manage the symptoms. So these are important. And now daily activities must be school attendance. Now what else could that be? School attendance, sporty sports eating and sleeping, now mood, depressed withdrawal no. Now solo history let's go to the history then. Oh, these are the right. Okay, so we got the headache description and the system review. System review, I saw that every symptom now system review system review, so you go through everything: cardiovascular system, respiratory system, GI symptom, vomiting. So vomiting vomiting only in the morning viral infection headache vomiting diarrhea that would be reassuring. Maybe having the viral illness, especially nutrition. So nutrition are important, especially in the teenager, no? Eating regularly, they are skipping meals, because if you are malnourished, you can still get that headache ဟုတ်တယ်မလားအဲ့တော့အဲ့ဒါကလည်းအရေးကြီးတယ် sometimes လာတော့ကတော့ headache နဲ့လာတယ်တကယ်တမ်းကျတော့ကိုကသေချာမေးလိုက်တော့မှတကယ်တမ်းတော့အစားမစားဘူးရေမသောက်ဘူးအဲ့ဒါကြောင့်လည်းဖြစ်နိုင်တယ် especially teenage and especially in the developed country တွေမှာတော့ eating disorder is the one of the another evolving problem they might not come as an eating disorder ဘာကြောင့်လဲဆိုဒီကလေးတွေကဘယ်တော့မှသူတို့အဲ့ဒါမပြောဒါပေမဲ့လာမယ်တခြား symptom တွေနဲ့လာမယ် and then that started to evolveအဲ့တော့အဲ့ဒါတွေက nutrition ရေးကြည့်တယ် endocrine လည်းရေးကြည့် especially growth abnormality puberty မှာဆိုတော့ either delayed puberty or early puberty younger children တွေမှာဆိုလို့ရှိရင် the increasing head circumference because that could be the size of hydrocephalus raised intracranial pressure ခုနမပြောခဲ့ပြီးသလို ENT တော့เนาะ dental symptom တို့ဒါတွေကလည်းထည့်ရမယ်နောက်ပြီး mental health is another thing it is very important to mention about it အဲ့ဒါက social history မှာလည်းလာနိုင်တယ်ဆိုတော့ထားလိုက်ပါလို့ current function ခုနသားတို့သမီးတို့ပြောပြီးပြီ medication history important ဟုတ်တယ်မလားခုနလည်းပြောပြီးပြီ primary headache မှာဆိုရင် caused by the medication especially like oral contraceptive ပေးပေါ့ဒီကလေးတွေမှာတော့အထူးသဖြင့်မတို့တိုင်းပြည်မှာတော့ဒါတော့သိအရေးမကြီးပါဘူးဒါပေမဲ့ developed country တွေမှာကျတော့ this could be the one of the cause ပေါ့နော်ဒီတိုင်းပြည်မှာတော့ကလေးတွေက well 14 to 16 years old they might already start OC pills for different reason body and when you so that's very important past medical history so past medical history are really important how especially if they already have any underlying medical problem for example like leukemia and the previous brain tumor so it could be the metastasis now the child neurological disorder such as neurofibromatosis type 1 and type 2 or tuberous sclerosis sometimes they can associate it with the brain neurological disease that can evolve later in their life or learning difficulties and learning difficulties sometimes they may not have the diagnosis but they are like because children are still growing how them evolve that's the other thing you need to pay attention whether it is a part of the genetic syndrome and then they may need further investigation at this stage development another thing that's why it is important global developmental relation so global developmental relation child headache social history so social history is very very important these headache can be triggered by social history most common things are bereavement all parents are separating or parental illness that can impact on the children or even the simple things like some moving school bullying bullying is very very common the house move stress headache now family history family history of migraine family history maybe genetic inheritance and also sometimes maybe copy maybe they wanted to copy so sometimes they just want to copy and pretend yeah maybe they are sincerely actually having a headache history being that you can confirm by the examination sometimes it will have the parental anxiety brain tumor so they wanted to rule out I wanted to make sure it is not their brain tumor that kind of thing now the mental health issue okay so we are going to the medical exam history oh yes these are the red flags in the history so red flags in the history persistent headache associated persistent visual abnormality changes in the motor scales that's also important. Kuna mama pure like kuna pure be like clumsiness to weakness to swallowing difficulty, which is very rare. Abnormal growth, seizures, personality changes or deterioration in schoolwork, and then predisposing factors for brain tumor. So examination, so there you go. So you got vital signs, general examination, and full neurological examination. So vital signs, so what are the vital signs you wanted to assess? Kuna taro tamiro pyo bibi, how to heart rate go teach it, blood pressure type, measure low me, how to. And then fever, no fever she need a place with general examination. So general examination system wise so general examination how so system wide cardiovascular, respiratory, GI, okay. So what else could that be? Eye check, yes, absolutely. Eye check is important. Okay. Anywhere else in your face? So you check the eyes. Anything you wanted to know? Oh, well, you wanted to look at as well in your face, in their face. So how about nose and throat? Ear, nose and throat examination is important. So solution, whether are there any evidence of ear infection? No. Now the palpation face and neck. It could be sinusitis. Sinusitis kind of headache, palpation of the sinuses. And also like the TM joint, no temporomandibular joint tenderness. Palpation the same time about fever, neck stiffness, neck pain, now the cougar, auscultation of the neck, eyes, and head for the brewery, which is thankfully it's very, very rare in children, but this is part of the assessment for the arteriovenous malformation. History are very aged as well. History maybe you can exclude it because it may be very unlikely. And also, like I said, AVM is very, very rare. But maybe it is one of the important assessment, especially in the adults. No, but that's one of the things, yes, auscultation of the neck, eyes, and the head area for the brewery, whether you see that or not. And the other, so that's in the general examination. The other thing is a general examination of skin. So you need to look at the skin, especially for in this country. It is important to look at any neurocutaneous stigmata, like, nephro, and like, because neurocutaneous marker, like Caffioli spots, now, like if you suspect that not accidental injury, any bruises, and with the psychological symptoms solution like self-harm marks, which is very common in this country, sadly. I mean, in the developed countries, so skin no, it's a part of the general examination. So general examination, head and neck palpation, localized examination of the head and neck, as me ENT. Now, skin examination. And then you need to have that full neurological examination. No, so full neurological examination, those does include cranial nerve, tone, power, reflexes, cerebellar signs, and also gait, because it could be unsteady. So if we go next one, so what are the reflex? So reflex symptoms we are. So the GCS got fluctuating, set the like visual abnormalities, which you find out, like you mentioned about the eye check. It's important. It will be evolved in your cranial nerve examination, focal motor weakness, abnormal gait, and coordination. So these are the reflex symptoms. So if these are the reflex symptoms, obviously you now think about like, okay, so these are the reflex now. What are we going to do? So differential diagnosis. So acute headache. So you may have that acute onset headache and the chronic headache. That will get it from history. So history are headache, headache, acute onset and fever, this is going to be emergency, and then you need to assess them acutely. Or actually headache or headache And then from the history examination, you might need to think about, oh, actually, it is more sort of common variety of the headache. And then you need to more concentrate on that management. So what are the common causes of headache? Well, the acute headache. Can you guess, anyone? Okay, yes, CNS infection, yes, and this is the one we don't want to miss, definitely. Anything else? Any other localized infection, no? ENT infection, injury, yes, and then they might come with a sort of, trauma, no? So, not necessarily it is acute body. No, I mean not acute, I mean common body, but there's sort of how frequently you are accident prone or these things happen. Okay, so common causes, so systemic illness, look at ENT causes, meningitis, and the trauma. There are some rare causes of acute headache like subarachnoid hemorrhage or arteriovenous malformation bleeds and then venous sinus thrombosis, but they are thankfully very rare. But it's sinus venous thrombosis can be associated with localized head and neck infection, so these two temas, so worry, especially with the meningitis and things. These two are very, very rare. Okay, how about the chronic headache? So now I think you all know about what are the common causes of chronic headache. What are they? Stress and tension. So in a way, so tension type headache is one of the things, yes, and the migraine, absolutely. Yes, definitely. So they are the common causes of the chronic headache. So yes, migraine, tension type headache, wonderful. And the other thing is like very common things like poor fluid intake and the trauma. Trauma is usually, like if you got the sort of whiplash injury, if you are involved in the RDA car incident, below now by my headache, debilitating, so we let hope to chance symptom, she around you, and also poor fluid intake, dehydration, that could be very common in the chronic headache. So yeah, fluid intake is important. To the chronic headache, the child worrying symptom, the lifestyle changes, regular eating, regular drinking is very important. So other rare causes, these are the rare causes, and the chronic headache is still be like raised intracranial pressure. Usually, so chronic progressive headache, so it could be, yes, it could be migraine. Have we ruled out the neurological signs and disease? Raised intracranial pressure. Another thing out of idiopathic intracranial hypertension, which is also called like benign intracranial hypertension or pseudotumor cerebri in the past, but now they change it. Cluster headache, like I said, it is rare, but it can happen. Carbon monoxide poisoning, or also it could be just a behavior or psychological. Yeah, let's think a little bit more tricky, Bono. It takes time to find out whether are there any underlying psychological or behavior problems. Evolve go 24 hours နေနေမဟုတ်ဘူးဟုတ်တယ်မလားအဲ့တော့ patient cooperation ကအရင်အရေးကြီးတယ်ဆိုတော့ချက်ချင်းကြီးတော့ပေါ်လာမှာမဟုတ်ဘူး These are the children who you might need to see regularly and find out things. Hypertension, like I said, thankfully in the children is a little bit rare, I have to say, unless you got the underlying problem. Hypertension, it would be more common in the adults. No? Okay. So B, any cause of decreased cerebral perfusion. What are the things you worry about that? Hold your thoughts and then put it in the chat box. And what are what do you want to think about? Right, okay, we move on to the investigation. So what will be the first investigation would you do then? What do you think? So we got neuroimaging, lumbar puncture, and blood tests. Heart failure anemia. Thank you, Han. Well, with the heart failure anemia, this is not going to be the first, isolated symptom or headache that you need to think about. With the heart failure, you will be more emphasizing on that, and then you will get it more in the cardiovascular issues, and that it may be part of the presentation. Anemia, they usually present more with the pallor, and then more with that sort of associated heart symptoms. That's what I would say, not particularly like they present with a headache and then you find out about this is very unlikely. But you might pick that up in your assessment and examination. So that's why I cannot stress enough about examination. Assessment, history and examination is the key. Right, okay, so blood tests. So would you like to start with the blood test in this investigation? What do you think? And what blood test do you want to do? Yes, especially with the acute headache, particularly presenting with the fever, you really want to do the blood test. And what do you want to do? CP? Do you mean CRP? You're looking for the inflammatory markers? CP auto, full blood count. Yes, full blood count and inflammatory markers, so CRP, because that's important. And then what other blood tests do you want to do? Electrolytes, okay, yeah, you could do that. Electrolytes, maybe for dehydration, but they will be, they will have any other symptom as well. But well, because mama drug and hobby, blood power so Police on duty never do it. Blood test power in order to carry a power like that. Hold them like, oh, full blood count, logic, no power. Oh, darling, major get a ton of pounds. Create a very stressful hold them. So, Davime, particularly bono, to the pin get go meningitis, adarius, a bacterial infection will worry pippy, so the cardiac no pouch. So, full blood count, inflammatory markers, electrolytes low, and what else would you do? Especially if you worry about meningitis, you will do there other things. Hold them. Liver function low but also viral infection liver function derange especially with the systemic illness remark. Clotting teaching, clotting low, and then bone profile, thyroid function, especially that or moderate chronic headache, hyper or hypothyroidism can present with this as well. Vitamin D toxicity, believe it or not, can present with us as vitamin D deficiency. Sorry. The vitamin A toxicity, but it's very rare unless there is no medication. And if they are not taking any medications or no vitamin A, forget about it. But vitamin D deficiency, and headache, body. Now I don't know what the evidence is. Blood culture, definitely well done. So full blood count, and sort of especially with the fever, blood culture is important. Okay. Right. So what would be the next blood test then? What would you do? Neuroimaging or lumbar puncture? Which one would you do? Neuroimaging. Well done. Okay. So yes, we would definitely imagine like CT. Yes. So yes, CT is actually. What do you think? CT and MRI scan? Because they both, we can do that now, isn't it? What's the advantages? So usually CT is quicker, and also acute and urgent neurological emergency masoli. CT is the first line of treatment because you can see that whether it is something pressing, especially with the brain tumor and obvious hydrocephalus, so you can action quickly. But MRI, it takes time, and they may not have the facility in everywhere to interpret or even do that. And also in the younger children, especially with the younger one who is irritating or crying, then you cannot do that because they need sedation. It takes time, and then you need the anesthetic input, especially when the child is not stable. So that's why CT is the sort of, first line. CT should be first line in acute and emergency situation. And the MRI is a non-acute situation. But obviously, the main advantage is to minimize the radiation exposure. And also, it can demonstrate better with the brain tumor like posterior fossa lesions, white matter abnormality, and congenital anomalies. But they got the drawback, like you need the expertise, you need more equipment, longer time, requires sedation. So, okay. So these are the indications for the urgent neuroimaging. So if you got the meningeal signs and symptoms of raised ICP, progressive or new neurological sign, significant head trauma, obviously you need to have the CT scan, severe headache or increase in frequency and duration, and presence of VP shunt, especially, we do see that in here more like if the child with the cerebral palsy or the child already is on the ventral VP shunt, especially in the premature clearance. In developed countries, solution, they tend to have the urgent neuroimaging, especially they come with a headache. Okay, so the next investigation, lumbar puncture. So lumbar puncture, no. So why do you do the lumbar puncture? What are the indications? What do you think? Why do you want to do the lumbar puncture after you've done your neuroimaging? Okay, absolutely. So meningitis, and then you need to know so meningitis suspected neuroimaging and excluded the hopefully causes of brain tumor. Then the next step will be infection or meningitis group. What are the benefits? Why we must do the lumbar puncture? So we need the confirmation. That will decide us to determine the duration, whether this is definitely confirmed meningitis. And also we need to know what, bug it's growing, because it will change. It may change with our provisional treatment. So that's why it is important. What are the other indications for the lumbar puncture? What else do we do if there is no fever? Can you guess? The other thing is stop. It is really rare, but I think you're more familiar in adults. For the subarachnoid hemorrhage, you must have the lumbar puncture. No, that's the other reason, especially if you highly suspect of the subarachnoid hemorrhage. They usually present with a sudden onset of severe headache. Lumbar puncture is one of the diagnostic tests. What they are looking for is elevated opening pressure and then xanthochromia in the CSF. No, address lumbar puncture. The other one is for the idiopathic intracranial hypertension, lumbar puncture. So these are the only thing I can think of for the indication for lumbar puncture. But what are the contraindications? Because it is an invasive procedure. What are the contraindications? Did you learn that in your fever topics? I'm really sorry. I think I'm a bit overrun, but hopefully not too long now. Yes, increased intracranial pressure. Anything else? Absolutely. So cardiovascular instability. Obviously, if you're not unstable, we can do that. Absolutely. Skin infection around lumbar puncture site. You've already learned, so that's good. I don't need to talk to you about it anymore. Bleeding disorder, fantastic. So yeah, so suspected raised ICP, instability, and also respiratory distress. You can do that. And if the child is having seizures, because you don't know, so you can do that. And then the rest, you already covered that. So management. So secondary headache, it depends on the etiology. If infection meningitis, and bacteria, otitis media, strongly suspicious of adenocarcinoma, but usually otitis media are mostly is viral. But if you are suspected and you don't want to get the consequences of complication, then yes, you can treat. So in the secondary headache, one of the things I wanted to mention about is idiopathic intracranial hypertension, because it could be the other cause of the, one of the common cause of the chronic progressive secondary headache. It is thankfully very rare. It's only in the 1 in 100 to 150,000 children in population. But they got the diagnostic criteria. So it's an evidence of raised intracranial pressure in absence of space-occupying lesion. They must have the normal brain structure and vasculature, normal metabolic, endocrine, and hematological system. That's where the blood tests are useful. So you excluded the other causes. And the opening pressure of the lumbar puncture must be above 28 centimeter water, or more than 25 centimeter water if the child is not obese or not sedated. And with this idiopathic intracranial hypertension, the child must have the formal ophthalmology assessment to properly assess visual field, pupillary response, and fundoscopy. Neuroimaging is another one. They might have to do the MRV after discussion with the radiology, is to rule out the structural lesion and also vascular disorder. And the lumbar puncture. In here, lumbar puncture, we like to perform endolocal anesthesia if it is possible. Do you know why that is? Oh, yeah. Sorry, Joe. Yeah, I only saw your thing. Spinal deformity, of course. Yes, spinal deformity. Then you cannot do that because you don't know, isn't it? Because you need to go through with the landmark. Too young and to prevent risk of anesthetics. Okay. Yes. Well, because lumbar puncture, because it is does anyone had a lumbar puncture? Because it's an extremely painful procedure. How to know? I know a to the piano, anesthesia much more kinder, no? A image about to be a made bono, the gelo, Dilomio, who back home, who has gone through like a cesarean section resolution. It's extremely painful. Lucidia don't end it down canema, Canadian can time. I know about him, clearly accept him about him, crying about him, CS pressure, them, how demala. I don't know. Not below GA, Belushin, it can affect the CS pressure due to CO2 retention. That's a purely reason. That's one. I know, fourthly, increasing CSF pressure solution, we might be having the sort of false diagnosis. So, okay, so management. So mainstay of treatment, the goal got preservation of the vision. Vision deterioration, now we are improvement of the headache. So usually medically managed surgically they are indication as you can see now. So medical management acetazolamide, which is a carbonate anhydrase inhibitor. So reduce the CSF production. Lifestyle modification to the pin. And lifestyle modification changes my solution, yet weight loss is one of the things. And other things, lifestyle changes lower my body. And migraine chain machine. So these are the goal of the treatment in idiopathic. So we're going to move on to the management of the primary headache. So primary headache, so migraine, tension type, cluster, and the medication overuse headache. So migraine. So migraine, mention low BB. So they will occur with or without aura prior to the onset of headache. Headache are unilateral, but it could be bilateral, pulsating, gradual onset. And then you all know about these associated symptoms. And that they are completely normal between attacks and also normal neurological examination. So these are the migraine criteria, diagnostic criteria. The international headache, the disorder classification in which are included in the resources. So စိတ်တကယ်လို့ပိုပြီးစိတ်ဝင်စားတဲ့ migraine ဆိုရင်အဲ့ထဲမှာနောက်ကျမှဝင်ကြည့်ပါ။ဘာကြောင့်လဲဆိုတော့ဒါတွေကဖတ်ပြဒါတွေမတူအတူတူပဲလေ။နောက်ပြီးတော့ slides တွေထဲမှာလည်းပါပြီးသား so ဒါ with the aura so I think someone mentioned about the aura symptoms so what are the aura no what are the aura ဆိုတာဒီထဲမှာဒီမှာဘယ်ထဲမှာလဲဒီမှာ aggravation by come on let me just see here okay so aura symptom so ဒါတွေကအကုန်လုံးက aura symptom တွေပဲเนาะ visual sensory အကုန်လုံးပါနိုင်တယ် but mostly ကတော့သူတို့ကဒီ light spawn of visual disturbance symptom တွေနဲ့လာနိုင်တယ် blur vision တို့ a little bit zigzag lines တို့ bright lights တို့အမျိုးတွေ့နိုင်တယ်ပေါ့ဒါပေမဲ့ they don't last more than 1 hour they can occur before or immediately after the onset of the headache and then they shouldn't last more than 1 hour that's why the makuna reflex symptomတွေမှာထည့်ထား persistent visual abnormality so you need to look into that in the headache and the management so again not pharmacological management ကလည်းအရေးကြီးတယ် migraine မှာဘာလို့လဲဆို migraine က it could be caused by the triggers are any stress or believe it or not some citrus fluids like orange juice or chocolate cheese they can happen so အဲ့ဟာတွေကို look out လုပ်ရမယ်အဲ့တော့အဲ့ဒီဟာတွေကို identify လုပ်ရမယ် headache history diary လုပ်ရမယ် now lifestyle changes so that's where healthy living lifestyle is အရေးကြီးတယ် so what does it mean by the healthy living lifestyle what do you think how are you going to educate your patient about it what are the healthy living lifestyle how do you understand that Healthy diet, yes, absolutely. So healthy diet is a mixed diet. ဟုတ်တယ်မလား vegetable ပါမယ် carbohydrate ပါမယ်เนาะအကုန်လုံးပါမယ် sleep, yeah, regular sleeping. ညမအိပ်ပဲနဲ့နေ့လယ်မှာအိပ်နေတာတော့အဲ့ဒါမျိုးတွေကမကောင်းဘူးလေ healthy BMI. So healthy BMI လုပ်ဖို့ဆိုတာ weight ဟုတ်တယ်မလား weight ကိုကြည့်ရမယ် and what is the other thing? So eating, sleeping. What is the next most important one for anyone, everyone? Water, yes, hydration, well done. What else? One more thing. Well, it is also important. What is? So eating, sleeping, drinking, adequate hydration, hygiene, yes, good, hygiene. Bowels, yes, good. How about daily exercise, activity, or even daily walking? You know, activity, something 20 to 30 minutes every day or 3 to 4 times a week is important for your both physical and mental health well-being. Exercise is very important for anyone at any age, for everyone. So, and the pharmacological management, yet simple analgesia, like paracetamol, ibuprofen, but you have to take it at the start of the medication, at the onset of the headache, no? Now, but it has to be adequate. So follow the BNF advice. The and the therapeutic dosage adequate medication at the onset of the headache is so yes, you need to think about triptans, no? Triptan are specific migraine and medication and the prophylaxis especially if the headache is more and more frequent, especially 2 to 3 times every week. So you need to think about prophylaxis. No? Propranolol traditionally is a mainstay. Now by they also recommend I just wanted to make sure. Yeah, topiramate low dose, no? Low dose topiramate. Okay, so the next one is tension type headache. It is actually more common in adults, but you can see in the children as well. They are also can be bilateral, and then they are usually mild to moderate severity. That's different from the migraine bone, no? And then they do not aggravate by the routine physical activity and not associated with those photophobia symptoms. Again, managed by the simple analgesia, avoiding the stressor, and the healthy living lifestyle is very important in chronic headache. Cluster headache. Dalekuna briefly mentioned BB, it is very, very rare in the children. But the cluster headache is a particular one you need to actually refer to the specialist, actually, at like pediatric neurologist at first suspected episodes, because it is a very excruciating pain. And then you need to confirm that diagnosis. The acute treatment, you can give the 100% oxygen, and also you can use the triptan, but it's very, very rare. The other one is a medication overuse headache that you should consider if, someone is taking the paracetamol or any NSAIDs for 15 days every month, or the triptans or opioids more than 10 days per month. So management are usually explanation, reassurance, withdrawal of the medication. You have to completely stop that medication. You have to warn the patient that the headache may graduate and they might get the rebound headache. Headache are temporarily or they need to persevere. And that's when the lifestyle changes. Expectation sheet is around so it is very important. So the take-home message. So headache is very common in children, and thorough history taken and relevant and focused clinical examination is a key to exclude the potential serious secondary causes of the headache. Management of primary headache includes both non-pharmacological and pharmacological treatment, patient education, and signposting to the available resources. It's very important. So these are the resources for the headache. There's a Migraine Trust website, and also HeadSmart is a really good one, especially for the increased awareness of the brain tumor. Please do visit those websites. They're really good. And the other one is ICHD, that's the headache diagnostic criteria website. For educational resources for any of you, it's a GK Medics. Got really good one. I really recommend Open Paediatrics, American one. That is also good. And also there's another one called oxfordmedication.com. So it's like oxfordmedication.com is also another free website, and they are some sort of, and they got all the sort of practical skills and demonstrations and everything. So please do visit them. I think someone mentioned about lumbar puncture previously in the previous sessions. So these are all in there about what you do and then what, about the basic knowledge. Information leaflet, this one, Australia, Burmese language, education leaflet. So patient education is really, really important. I cannot emphasize enough for everyone to look after their own health. No, these resources are very useful. Okay, thank you for listening. Any more questions? Can migraine go away by itself? Well, Joe, it depends on whether you can really, whether you can distract yourself, because sometimes migraine and detention type headache, they can overlap. So the most important thing are Eddie, look after local, now we don't healthy living lifestyle. Now just go back and look at every, declaring 1.5 to 2 liters a day. It's really important. Sometimes they barely drink, so it's really important, no? And now to go, mama request low chinaro, hope about it. My feedback form please fill up. We really need the feedback. To the small group teaching. There are so many different circumstances. So we wanted this to be really effective for everyone. So any advice or anything you want, please let us know, and then we try our best in this online teaching. Please do give us a feedback. Are there any precipitating factors? Well, obesity is one of the other things. Idiopathic intracranial hypertension, it could be. So that's the I can't think of any other precipitating factor, but like I mentioned that this is the secondary headache. So there is an underlying causes. The most important thing, you need to make sure those secondary causes of the raised intracranial pressure is excluded. That's the most important thing. No? Okay, right. Thank you so much, everyone. And hopefully we see you again soon. And take care and stay safe.